Good morning. Thanks, Donna. So first I'll start with a few words about the Scirocco project. So for us it's important, first of all, since it is to some extent continuation of still ongoing process. I mean the European Innovation Partnership on Active and Healthy Aging. So it's good to see that the initiative, which started 7 years ago, was initiated by the Commission, then was taken over in this positive sense by the stakeholders, like, for example, members of the B3 Action Group, who then created something which is tangible, which is used by integrated care community. It's also for us as the Commission. It's not only the maturity model or Scirocco model. It's not only important because it stems from a process we started. It's also useful for us. At the beginning of last year, an expert group on health systems performance assessment, a group which is composed of representatives of the member states, and the Commission is co-chairing the group, also is responsible for the secretariat of that group. The group published a report on assessing integrated care, but part of that report is about building blocks, so the issues, the elements which need to be taken into consideration when designing and implementing integrated care. And the maturity model was an inspiration, or one of the inspirations for that, so that the concept of those building blocks or areas which are important for integrated care was also taken from the model. Quite recently, a study was finalized, study financed from the third EU program, commissioned by us, DG SANTE, so the Directorate for Health and Food Safety, and also by CHAFEA, the agency, study on assessing integrated care. And part of this study, which deliverables hopefully will be published quite soon, part of that study was the assessment of readiness of some health systems in the EU, readiness for integrated care, and also for that purpose the tool was used. So I'm really happy that the idea of the tool is developing, that you managed to improve it. Okay, and now the presentation. I hope I won't break anything like last time. Okay. So this is the title. It will be mainly the Commission's perspective on supporting deployment of integrated care, also in this digital context. So starting with the political context, in 2014, a communication by the Commission was published on effective, accessible, and resilient health systems. This communication is a kind of guideline. It sets the ground of activities of the Commission in terms of health systems. And as you can see, there are three strands of, three fields of activity relating to effectiveness, accessibility, and resilience. And in this logic, integration of care is contributing mainly to effectiveness, which doesn't mean that it doesn't have any impact on accessibility or resilience of health systems. Last year, almost a year ago, in November 2017, a companion report was published. This report is a part of so-called State of Health in the EU cycle. It's an exercise done by the Commission in cooperation with the OECD and the European Observatory on Health Systems and Policies. This companion report presents Commission's perspective and Commission's and other stakeholders' activities in the EU in the field of health systems. And as you can see, point 3, the third chapter of this report relates to integration of care, which means, if we are talking about political context, that integration of care is one of the most important areas of interest of the European Commission. And the last political document, communication on integrated care on digital single market, this communication was published half a year ago in April this year. It, as you see the title, it's on enabling integration of care, enabling or supporting healthcare in general on digital single market. There are 3 pillars of action, and especially the third pillar is about tools for citizen empowerment and also person-centered care. These are the actions proposed as a part of that pillar, but since we don't have much time, I present rather this slide where the actions are summarized in short. So on one hand, there are activities relating to building capacity, developing know-how, etc., on implementing new care models, by which also integrated care is meant. On the other hand, there is an issue, or the Commission wants to support actions around mobilizing investments for transforming health systems at scale for scaling up integrated care. In practical terms, there are different activities, different ways of supporting development of new care models. So first of them is an Integrated Care Resource Center. The center was launched a couple months ago. Here you can see the address where you can find this resource center. I don't know how visible it is. Okay, it's not very visible, I mean the slide, but there are different areas relating to integrated care, and in this resource center you can find documents, reports, collection of good practices, etc., relating to important issues, important elements of integrating care. Other resource, rather knowledge resource, is a best practice portal. It's on non-communicable diseases, but of course, obviously, since integrated care works very well, especially with tackling non-communicable diseases, there are many common points with that best practice portal and activities in integrated care. Talking about technical assistance and knowledge transfer, this year in Utrecht and last year in Dublin, during international conferences on integrated care, I mean the European Commission in cooperation with CHAFEA, we organized so-called implementation rooms. The overall topic for the rooms was how to design and implement integrated care, lessons from early adopters in Europe. We know that there are parts of the EU, the regions which are quite well advanced in integrating care, and we wanted those early adopters or pioneers to share the knowledge, their experience with those who would like to follow. You can see which were the topics of those implementation rooms. I won't enlist them, but we tried to, once again, cover different aspects, different areas relating to integration of care. The other form of technical assistance is the so-called Structural Reform Support Service, SRSS. We like abbreviations in the Commission. This service was created in general to help member states reforming not only health systems, other sectors, etc., and obviously healthcare reforms are part of this picture. They are supported by SRSS. Here you have some examples of support already given by SRSS. Basically, SRSS pays for technical assistance either provided by commission experts but also outsourced. So, talking about money, here there are. This slide shows current and hopefully future possibilities for financing also health reforms. So I won't spend much time on it, but I want to highlight that in terms of the instruments for the period 2029-27, it's the Commission's proposal. Now it's up to the Member States, to the Council, and also to the Parliament. They will decide how exactly those instruments will look like. But the message is that there are, and hopefully there still will be many instruments which can support reforming health systems. The problem with investing in healthcare is that very often the picture is like that. I mean, infrastructure and medical innovations, these are the areas where there is quite a lot of investment. Those investments are interconnected, but the problem is with investing in new care models and services, meaning also investing in integrated care. To try to make this triangle full, to also connect investments in new care models with other types of investments in healthcare. Last year we organized a seminar on strategic investment for the future of healthcare, that was the title, where there were stakeholders both from the healthcare area and also financial institutions like the European Investment Bank, other banks, etc. We wanted to make those people talk together to try to figure out how investments in developing healthcare systems could look like. So the main messages were that there is a need for long-term investment strategies. It's obvious. I mean, the reforming healthcare systems takes a lot of time, so the time perspective should be long. There is a need for integrated approach. So thinking about infrastructure, technology, and services when we talk about investments. So trying to make this triangle full, connected. So as I said, not only infrastructure, medical innovations, but also new care models, including integrated care. The other messages from that seminar were that it's good to combine different financing instruments, to blend them. Also to look beyond usual suspects. I mean, on one hand, national budgets, on the other hand, the EU funds. Look for new financial instruments like, for example, social bonds, etc. And also it is important that when planning investments, we should all take into consideration as well payment models, since the way services are paid for has an impact on also on the way the systems are designed and function. So thank you very much.
Thank you very much, Filip. Can I just ask our audience, do you have any questions that you would like to pose to Filip? Yeah, Diane? If you could just say who you are, Diane, so that everyone online knows who you are.
Hello, Filip, Diane Whitehouse from ETEL. I found your talk extremely informative, so thank you. I'm just a bit curious about the social bonds that you mentioned, in particular in your very last slide. It's not an area that I know very much about. I wonder whether you could tell us what that would mean for integrated care.
frankly speaking, I'm not also an expert on social bonds, but they are the way of using mainly private money to invest both in health and also social care systems. There is a growing number of investors who look at investments also from this broader social point of view. So they don't invest, they not only invest to have financial return, but also to have, let's call it social return. I mean, well-being, better health conditions, etc. So there are possibilities, and we think that was one of the messages or conclusions from that seminar, that it's looking for those opportunities. It's also some proposal for health authorities.
Thank you. Any other questions for Filip? No? Okay, well, listen, thank you very, very much for that, Filip. I think that was an excellent context for us, and thank you very much for your time.